Hi, so as a speech pathologist, I work with patients with mild cognitive impairment, and we often need to start in the area of attention because patients will have various complaints about inability to focus in an environment. And so I just wanted to cover what attention is and the 5 different types. So attention is the behavioral and cognitive process of selectively concentrating on an aspect of information. So there are 5 different types. There's focused attention, sustained attention, selective attention, alternating attention, and divided attention. Focused attention is focusing on one thing. An example would be writing a paper or taking a test. Sustained attention is focusing on something for a long period of time, for example, taking a webinar or taking a class. Selective attention is focusing while distracted, for example, talking to someone while in a crowded restaurant. Alternating attention is focusing on alternating tasks, such as you're trying to follow a recipe and cook at the same time, and you're going back and forth trying to focus on both of those things. And then divided attention is focusing on 2 things at once, for example, talking to someone while you're texting. So in my practice, I typically work with patients with different types of attention problems. Today, we're going to be focusing mostly on selective attention with a patient having a complaint of focusing on a conversation in a crowded restaurant and having a difficult time understanding what their communication partner is saying. Okay, so I'm going to be talking about my hypothetical patient, John or Jane Doe. And this is a patient who has an attention deficit, and they have been through a interview with me where I've determined that they're basically saying they're having problems hearing information in a background of noise in a restaurant, for example. And I have written a goal. I would typically write a goal like this: increase selective. The patient, John or Jane Doe, will increase selective attention by 25% over baseline in 3 consecutive sessions. And I will use a strategy of self-questioning, having the patient learn these 3 steps and then internalize them, where they're going to be using them every week of therapy, okay? Number 1, do I understand? They will be asking themselves this question while they are working with a communication partner. Number 2, if they're going to repeat what they heard a person say to them, silently to themselves. Number 3, if they do not understand, if the answer is no to do I understand, they're going to ask to repeat and or slow down. Ask their communication partner to repeat and or slow down the information. Okay? So that will be the strategy that we'll be using. I will give them a visual cue when they come in for therapy where they can read that information, they can be reminded of those questions, and then they'll have like a homework assignment to be practicing that in their real life outside of therapy. They will apply the strategy to the intervention, a process training intervention, where I will recreate a situation where they're going to be having a communication, turn-taking type process in noise that I'll introduce. So they're going to be asked questions while distraction of noise is presented that I'm going to pretty much present with some sound effects. The type of questions that I will ask them will be, I'll ask them to tell me antonyms of high-frequency words, like, tell me the opposite of hot, being cold. I will ask them synonyms of high-frequency words, smile being the synonym of grin, or grin being the synonym of smile. And I might ask them categorization of noun-type questions, name 3 types of vegetables, 3 types of fruits, that type of thing. So I just want to give an example of the process training. I would use the type of sound effects that I would use to have them try to focus on answering the question while they're listening to that background noise in a restaurant. So I go to iTunes and just pull up background noise in restaurant. So I will do that right now. So this is restaurant ambiance. Sound of restaurant ambiance. So I would play that. and I would then say, okay, I would give them 10 words and ask them to tell me the antonyms for each of those words while they're focusing on what I'm saying. They're listening to this sound effect in the background. And I am then eventually going to, over time, increase the sound level, the decibel level of the sound effect to give it a little bit more rigor in the exercise. And over time, I will be measuring how the patient's doing with achieving their goal of achieving 25% over where they began with me in terms of accuracy. So what did we learn today? We learned that patients with MCI often have attention problems. And so I went over the different types of attention. I showed you that strategy and intervention are very important, working with these patients, as well as helping them carry those skills over into their real life. And I also showed an example of a goal that I would use for a patient with selective attention, as well as a strategy and an intervention to help them improve in that area. So I want to thank you for joining me today to learn about attention, and I'm hopeful that you will continue to watch the series on how to help patients with mild cognitive impairment. So thank you so much for joining me, and I hope that you subscribe to my channel. Have a great day.